Hi there. My name is Ansara Piebenga, and my younger daughter had a kidney and liver transplant 16 years ago. And at that time, there was less involvement of patients and families in medical care, but luckily that paradigm has been changing. Through the years, our daughter and we have become valued partners with her care team and are very involved in post-transplant care decisions. And I'm very excited to introduce to you today someone who's become very close to my husband and me, and our transplanted daughter, Lauren, and my entire family during these last 17 years. Dr. Brad Warady is the director of the Division of Nephrology, Dialysis, and Transplantation at Children's Mercy, Kansas City. He's also a professor of pediatrics at the University of Missouri, Kansas City School of Medicine. In addition to his role as a clinician, Dr. Warady is internationally recognized as a writer and researcher in the field of pediatric nephrology. He's a leader in the field of patient and family-centered care, and he's here today to talk about shared decision-making in transplant. Without further ado, I will turn it over to you, Dr. Warady.
Well, thanks, Ansara, and it's a pleasure being here today at your meeting, and I'm going to share my slides. So we're going to talk about shared decision-making and pediatric transplant, something that you may or may not know about, although I think most of you have probably been involved in it and maybe don't know it. But when we get started, I want you to look at these pictures. And this is going to be the first of two polls that we have. So I want you to take a close look at them. Okay, and then have the next slide, please. I'll move that. And so the question is, what is the profession of these men? Are they athletes, astronauts, doctors, or teachers? And so you can go ahead and put in your answers. And if you know all of them, then I know how old you are. Okay, so it's close between doctors and teachers. And in fact, they are doctors. And I'm going to move to the next slide so we can stop sharing the poll. Go. So here's their pictures. They were all TV doctors. So the one on the left is Dr. Kildare. The one on the top is Marcus Welby. The one on the bottom was Ben Casey. And the one on the right is Doogie Howser. And I show you these pictures. Whoops, we don't need the poll question anymore. I show you these pictures because back in the day when they were TV doctors, for the most part, whatever the doctor said is what happened. And that's, as you can see here in this slide, paternalism, meaning that the clinician or the physician puts together a plan and communicates that treatment plan to the family who accepts the plan. Now, on the other side of the coin is the informed choice, where the family decides on the plan after gathering information from the clinicians and other sources, be it in social media or other individuals that they know who maybe have had similar experiences. But what we're talking about today is, I think, really the goal that we should all have in shared decision-making. And in that scenario, the clinician explains the different treatment options to the family. The personal values of the patient and family are delineated, and then the clinician and the family jointly determine the treatment plan. So that's shared decision-making. Now, sometimes this is important because oftentimes there can be differences of opinion or differences in priorities of the patients and families and the physicians or other clinicians. And I want to show you some results from this workshop. You can see here, this is a publication on improving clinical care for children with chronic kidney disease, but it can actually apply to any organ, if you will. But it was a workshop that we had. And what was important when you look at this group is that this is a group of providers. So they were nephrologists, they were transplant nurses, they were dialysis nurses, social workers, pharmacists. But in addition, they were a number of patients and family members as well. And again, Ansara is right here, and her husband John is here, and a number of other patients and families, because we wanted to get the perspectives of everybody involved, again, in patient care, and really to highlight the similarities in their perspectives and the differences in their perspectives. So this is one of the sort of tables from the publication. And here we're looking on the bottom, you can see text of key clinical recommendations. So a number of clinical recommendations came out of this workshop. On the left side of the slide, you see the perspective of the physicians in terms of what they thought was important. And importance is based upon the size of the circle. And then on the right side is the perspective of the parents and caregivers. And again, importance is the size of the circle. So let's look at circle number 2. Circle number 2 was addressing shared decision-making. How important is that? So if you look here on the physician side, you can see number 2 is right here. So it seems to be equally important to a number of these other key clinical recommendations. But if you look in the right part of the slide, number 2, you can see it's a very, very big circle. So the parents and the caregivers and the patients felt that it was exceedingly important, in fact, more important than some of the other key clinical recommendations. If we look at number 13, that was strategies and support to achieve successful self-management. So here you can see 13 on the physician side, again, equally important when compared to all the others. And here's 13 on the patient and provider side, very large. So you can see that these clinical recommendations, which were generated by both providers and patients and families, have more importance for one group than another. So it just points out the fact that oftentimes there are different perspectives, and that's why that shared decision-making is so important. So we know from the literature, shared decision-making enhances family satisfaction. It improves treatment adherence. It actually leads to improvement in the health outcomes. And as noted here, when there is active shared decision-making, there appears to be a decreased rate of hospital readmission and the development of complications in individuals, both children and adults, with complex chronic conditions. Now, a question has arisen, well, what about the use of shared decision-making in populations that might be considered disadvantaged or not really sort of sharing in the health equity that we hope to achieve? Does shared decision-making make a difference in these groups? And so these authors went to the medical literature and they looked at all the literature that addressed shared decision-making and that also included individuals in one of these 5 groups. And the 5 groups, you can see, were minority ethnic groups, low literacy, low education minority ethnic groups, low literacy groups, low socioeconomic status, and medically underserved. And so what they wanted to see is what's the impact of shared decision-making in these groups of individuals? And this is what they found, that shared decision-making, even in, if you will, disadvantaged populations, was associated with subsequent increased knowledge on the part of the patients and families, improvement in the informed choice. It enhanced participation in the decision-making, and it reduced decisional conflict. In other words, the providers and the patients and families were more on the same page. And then importantly, disparities or differences in knowledge, uncertainty, and treatment preferences between the disadvantaged groups and, if you will, the more privileged populations tended to disappear. So again, it put everybody more on the same page by having that conversation between the patients, the families, and the providers, irrespective of your background. Now, if you're going to have conversations with your providers, I think one thing that is so essential is recognition of the importance of health literacy. Because health literacy, and I'm going to define that for you in a moment, health literacy is the key to successful education and to well-informed communication. So this is the definition of personal health literacy, and this comes from the CDC. As you can see here, it says personal health literacy is the degree to which individuals have the ability to find, understand, and use information and services to inform health-related decisions and actions for themselves and for others. And this definition, as you can see here, emphasizes the people's ability to use the health information rather than just understand it. And it focuses on the ability to make well-informed decisions rather than appropriate ones. So again, health literacy is critical if we're going to all participate in shared decision-making and make the best decisions with respect to the health of the patients and the families. This is a quote from Rochelle Walensky. She is the director of the CDC, and she said, "Health equity is crucial to our mission. The COVID-19 pandemic has brought long-standing health inequities to the forefront and presented a critical opportunity to achieve optimal health for all. Health literacy strategies advance health equity, offering guidance to the public in clear, understandable, and digestible ways, saves lives during moments of crisis." And then I think even a better quote is this one here from Regina Benjamin. And she says, "As clinicians, what we say does not matter unless our patients are able to understand the information we give them well enough to use it to make good healthcare decisions. Otherwise, we didn't reach them. And that is the same as if we didn't treat them." So health literacy is at the core of shared decision-making. And it's something that we as providers have to think about every single day when we're explaining things to patients and families. And you, on the other side, need to recognize the importance of that and sort of ask the providers to, in fact, provide you the information in a manner that you do, in fact, understand. So this is our second poll question. How many adults in the US have basic or below basic health literacy? So the choices are 10 million, 30 million, 50 million, or more than 70 million. Okay, so I think we have our answers. So you can see that, I mean, it's really nicely split between 30, 50, and more than 70. And the answer actually is more than 70 million adults have basic or below basic health literacy. And in fact, the number is estimated to be 90 million adults in the US fall into that category. So you can see that this is it's a big issue. And you know, again, it's not having proficient health literacy is not just an issue for those individuals who maybe haven't gone to college or had advanced educational degrees. Even college educated individuals oftentimes have only basic or even below basic health literacy. In fact, let me show you another couple points about that. We're gonna move that poll. Okay. So here's some stats. Only 12% of adults in the US, that's a small percentage, only 12% of adults in the US have proficient health literacy. 14% of adults in the US have below basic health literacy. And importantly, 1 in 10 adults can't complete below basic health literacy tasks for their children. And you can see one example is using the dosage chart for an over-the-counter medication. They can't do that in an accurate manner. And so you can understand how that may have a significant impact on the outcome of those kids. And importantly, adults with low health literacy are more likely to make mistakes in giving their child medication and less likely to get preventive care for their child. So health literacy or problems with health literacy is a very prevalent problem. And it's something that we have to work together on to improve, to decrease the prevalence of this problem because it has an impact not only adult healthcare, but pediatric healthcare as well. So as providers, when we're providing information, again, as it relates to shared decision-making, we have to make sure we're using plain language. We have to try to avoid complex medical terms. And then when you're giving written information, it has to be in a very simple layout, a simple format so that it's easy for all of you to digest. And again, I'll say to you, if you're getting information that you don't understand, or it's written information that it's unclear, it's really up to you to say to the providers that you don't understand it, and you need the information in a more clear manner, so that you can help make decisions, so that you can, in an effective manner, participate in shared decision making. Now, the other unique issue with respect to shared decision making pertains to the pediatric population and the child themselves. You know, as we all know, children with a chronic disorder or children with a transplant, they're sort of an issue in transition, right? they're moving as like a moving target, starting from the young child, moving to the young adult. And as they get older in age and in maturity, their potential participation in shared decision-making increases. So this is a nice slide that looks at the transition of that transplant individual, again, from childhood through young adults. And you can see during that pre-transition period of time, 2 to 9 years of age, we sort of refer to the parent as the CEO of healthcare tasks and the child as the recipient of care. Then between 10 and 12 years of age, the parent transitions to the manager and the adolescent to the provider of care. And then again, in the middle and late transition, you can see that the parent moves to the supervisor and even the consultant as the adolescent moves to the manager and adult supervisor. And I think during that period of time, ideally, we're seeing more involvement, more participation of that adolescent in shared decision-making. And then finally, when they move to the young adult period of time, when they're between 18 and 25 years of age, as probably was talked to you in prior talks about transition of care, this is when the young adult is, again, referred to as that CEO of care, the parent is the consultant. And in this situation, that young adult should be part of shared decision-making. And hopefully, they've been educated about that role over the course of their transition education. Now, the other important issue with regard to shared decision-making are decision aids. And as you can see from this slide from the American College of Cardiology, on the top of the left part of the slide, it says partners in care. Decision aids are tools to help you make informed decisions with your care team that are right for you. And then again, on the bottom right here, decision aids are helpful when there is more than one treatment. There are big trade-offs or the plan forward is unclear. So the decision aids help you sort of put onto paper all the different factors that you want to consider when you are assisting, if you will, assisting the clinicians in understanding what is best for the patient and for the family. This is one such decision aid, and there's a lot here, and I'm going to show you, I'm going to break it down for you in a moment. And I just want to point out here is that that same decision aid is in Spanish, it's in French, it's in Japanese, Chinese, so it's in many, many different languages. But what are the components of this decision aid? So here you can see the Ottawa Family Decision Aid, and this is point one, the clarity of the decision. So these are the questions that you have to ask and answer for yourself. What decisions are you facing? What's the reason for making this decision? When do you need to make a choice? And how far along are you with making a choice? And then you can see the different options for the answers to that last question. Again, this is just to allow you to reflect on, again, issues that need to be addressed. Then you have this one that looks at values and let's see, it's getting blocked here from the top of my slide, but it looks at reasons to choose a certain option and reasons to avoid an option. And then you ask yourself, which option do you prefer? Is it number one, number two, or number three? And then who else is involved in helping choosing these options? And then what role do you prefer in making the choice? Do you want to share the decision with someone? Are you going to decide by yourself after hearing views of others, or are you going to allow someone else to decide? Again, there's no right or wrong answer here. It's just allowing you to reflect on things that need to be considered. And then number three, you want to identify decision-making needs. So knowledge. Do you know the benefits and risks of each option? Yes or no? And if the answer is no, obviously that's something you need more information about. What are your values? Are you clear about which benefits and risks matter most to you? Do you have enough support and advice to make a choice? And are you choosing without pressure from others? Important questions that you have to answer for yourself and then act upon them accordingly. And then in terms of certainty, do you feel sure about the best choice for you? Again, that's just a reflection. And then finally, planning the next steps based on needs. So as far as knowledge, if you feel you do not have enough facts, it gives you different options that you may take to get that information. In terms of values, if you are not sure which benefits and risks matter most to you, again, a number of different options. Talk to others who have made the decision. Read stories of what mattered most to others. Discuss with others what matters most to you. In terms of support, if you feel you do not have enough support, again, two options. Discuss the options with a trusted person or find help to support your choice. And then if you feel pressure from others to make a specific choice, a number of different options to consider. focus on the opinions of others who matter most, or share your guide with others, and so on. So these kind of decision aids really allow you to reflect on all the factors that you probably need to take into consideration when you're working with your providers to make the best choice for your child. And these decision aids, this one and others, have proven to be very, very helpful for families, even of transplant recipients. And indeed, there is a small literature on the use of shared decision-making and decision aids with pediatric solid organ transplants. Now, much of the literature really arises from the perspective of the providers themselves. But this is one nice article that was the parents' perspectives on shared decision-making of their children with solid organ transplants. And this was an article that reviewed the course of some 51 parents, 51 parents whose children received a transplant. And there were kidney transplants, liver transplants, lung transplants, multi-vis transplants, and followed them over a period of time to get their perspectives on shared decision-making. And in this particular article, they asked the families about 4 different components of shared decision-making. Active participation of both the clinicians and the families in making treatment decisions, the exchange of information, the discussion of preferences, and then the joint determination of treatment plans. These were the 4 domains, if you will, that the authors queried the families about. And here you'll see there was a variety of different answers. So if you look first at the parent and provider involvement in shared decision-making, number 1, you can see that 31 individuals, or 65% of those surveyed, said, I fully believe that it's a two-way street. Parents need to educate themselves, and doctors can only do so much and can only know from what the parents tell them. And this is just an illustrative quote, if you will. Everybody didn't say that, but that was sort of an overall responsiveness from those 2/3 of those individuals. But then there were individuals that were more passive, and they just said, we just do whatever the doctors tell us to do at his appointment. And so it points out that it's not, all or none. Everybody doesn't do the same thing, and what one group does is not right or wrong versus what the other group does. So some people were much more passive in terms of sharing the decisions with regard to the participation. About sharing information with each other, you can see that 44% said we ask a lot of questions. We want to really understand what is going on. And then in terms of giving the provider information, some individuals said I participate by keeping them informed of what's going on with my child, because obviously you all know best about your child. In terms of expressing treatment preferences, an illustrative quote from about 3/4 of the respondents said, the doctors go over what they feel needs to be done and why. We ask questions to understand why they want to do the things that they do. And again, I think that's great, and that's what should be done in many cases, in most cases. And then 1/4 said, we always give our opinions, and we're not afraid to ask questions, which is terrific. And then finally, in terms of agreement on treatment plan, you can see that 40% again said something along the lines of, I'm not making medical decisions, but rather participating in all the medical decisions that are made by the doctor. True shared decision-making. And then finally, again, 1/3 said that the doctors always let us know what they're doing and why they're doing it. So we usually go along with what they say. So a bit more passive, but again, recognizing they still needed that information so that they know what's going on. So again, shared decision-making can be practiced in a number of different ways by people. And again, there's no right or wrong answer, but I think being informed is most important for all of you. Out of this same article, the parents that were again surveyed put together what they thought were provider attributes that really facilitated shared decision making. Number 1 was that the providers were accessible and continuously available. And I highlighted this because this is oftentimes what is most challenging for the providers. Having the time to answer all the questions, having the time to provide all the information that's necessary. But it's critically important that we as providers make that time as part of shared decision-making. They felt that another important attribute was that the providers would be approachable, that they welcome parents' questions without judgment. There are no bad questions. There are no stupid questions. So that's essential for effective shared decision-making. They had to be dependable. They do what is promised and is expected. And of course, knowledgeable. Hopefully all the providers have expertise that is regularly shared with the patients and families. They need to be supportive, anticipating families' needs, and oftentimes providing assistance to the families before it is even requested. And then finally, and I think essential, is to be transparent. As providers, usually we have good news, but sometimes the news isn't good. But I think it's really important that we always disclose what we know and what we don't know. And I think that is, and you know better than I do, but I think that's well received by parents of children with transplants. Lastly, this is an article that was recently written on the perspectives of providers with respect to shared decision-making. And this is in pediatric chronic kidney disease, but I think it holds true for all disorders. And I just want to share with you 4 quotes that came out of this article that I think are, again, addressing a number of different components of shared decision-making. The first one from a physician who said, during consultation, you are spending time covering all the organ stuff. You perhaps don't have time to address what they really want to talk about, what's high on the patient's agenda. So this is this time issue that we as providers need to address. A nurse said, I do try to make a point of speaking to the kids rather than just to the adults and making sure they feel as though they are part of the clinical process. That's getting everybody involved, especially, again, as these young children become young adults. Third quote, it's often a negotiation with the families, so we really need to work with the families and have good communication skills and build trust. And again, I think this emphasizes the importance of health literacy in communication. And then finally, a dietitian said, I think it has to be a partnership. I really do. It shouldn't just be the patient's choice because we know medically what the patient needs. It goes both ways. But in the end, the patients have their life to contend with. It's good to have everyone's perspective. And I think that nicely sums up shared decision-making. So hopefully you get a better understanding of what shared decision-making is. Hopefully I've encouraged you to actively participate in shared decision-making. And I hope that you can encourage your providers to do so if they're not already taking that approach and communicating with you. And finally, I want to close with a picture from Kansas City, where I'm from. This is the NFL draft for those of you who are football fans. We are now the football capital of the world, Super Bowl champs and the NFL draft. And I encourage all of you to come visit Kansas City if you've never been there. It's a great place to live and a great place to visit. So thank you all very much for your attention.
Thank you so much, Dr. Warady, and go Chiefs. Woo!
There you go. That's right.
That was very interesting and informative. Really appreciate that. We have a couple questions. I think we
Sure.
can go a little bit over. We're going into a break, so we have some time to ask a couple questions. The first one is, what are some things that clinicians and families oftentimes see most differently when it comes to post-transplant care?
Well, I think sometimes clinicians may not understand the burden of care in terms of the kids really having an optimal quality of life. We oftentimes say, take these medicines 2 or 3 or 4 times and drink this much fluid so your kidney's working well. And all of these things that it's, if you will, sometimes simple to request it, but it's not easy to carry out. And so I think it's that reality check in terms of what we're asking. And I think it's really important for parents and kids to tell us these things. And Ansara, you know very well that oftentimes you've said to me, well, we understand why you're recommending this, but it's not feasible to do this. And I think that's really important. So I think that's the thing I think that's oftentimes not well understood, and it requires that partnership, that shared decision-making to actually sort of meet all the needs.
Exactly, and relationship building between providers and families. I agree. Let's see, the next question is, for which things can a family expect to have a lot of say in post-transplant care, and for which things should they rely mostly on the opinion of their healthcare team?
Well, I mean, I think the healthcare team is obviously the best ones to say which medications the kids need to receive, for sure. I think that the families and the children, first of all, always need to tell us if they're having intolerance of certain medications, because the worst thing that can happen is kids having intolerance and then not getting their medications without letting us know. Because oftentimes there are alternatives, or there are other ways to sort of enhance the tolerance of those medications. So I think defining the medications is really our team, the healthcare teams. But again, how well they're received, are there any obstacles to meeting those medical needs? That's where the families need to share that information with us.
Okay, that's important. Let's see, the next one is, what should I do if I feel like my child's doctor isn't listening to what my child wants and what our family wants for our child's care? Are there resources available for me to help improve our communication?
Well, I would say that's the essence of shared decision making. And I think you have to have a conversation with your doctor. And I think sometimes you're going to have to ask your doctor to sit down and please, don't be rushing out the door. And you really there's some things that you need to share with them that that has an impact on your child's outcome and on the family's outcome. And I think, at least in pediatric care, I think in most cases they are willing to listen and to spend the time. I mean, we're all very, very busy, but we're all here for one reason, and that's to have the best outcomes for our kids and families. I can tell you that for sure. So they'll listen. And if it's a situation where you say, I'm not getting anywhere, that's when I think you go to your social worker and talk to your social worker, and you say, somehow there seems to be a disconnect between me and my physician. And I love him. I know he's doing a great job taking care of my child, but I really want to talk to him about some issues that we need to address, for my child or for the family. And I think usually somebody else from the team may be able to get to that position and facilitate having that conversation. But most importantly, don't ignore it. I mean, if you have an issue, you have to address it, because if you ignore it, you'll be shooting yourself in the foot later on because it hasn't been addressed.
Right. No, that's true. Very true. Let's see. The next one is, what efforts quantify the lower cost of healthcare when families are involved in decision making? And do insurance companies encourage the practice?
The practice of shared decision making?
Yes.
Yeah. Well, I'm sure insurance companies would encourage the practice. I've never talked to an insurance company about that. But because shared decision making allows one to have everything on the table, if you will, it is associated with less healthcare costs, because you end up having greater adherence to the therapy, and in turn less complications. And obviously, with fewer complications, the healthcare costs go down. And I could give you example after example of that scenario. I'll give an example of Ansara's daughter, Lauren. I mean, they have been very, very adherent. We've practiced shared decision making for the last 17 years. And Lauren, over 17 years, has had very, very few complications, thankfully. And a lot of it's due to her adherence. And as she's moved from a small child to that, she's the CEO of her care now. She's experienced everything that I've talked about with very, very few complications. So I think, from an insurance company, I think they would encourage shared decision making, because it sort of facilitates that partnership between providers and families, which is essential if you hope to have the best outcome from a clinical standpoint, and, if you will, the most fiscally sound outcome.
Right. Absolutely. Wouldn't it be great if we could all have a way to communicate directly with our insurance companies and explain that this is incredibly important?
Yes. Yeah. Well, and I, to that point, this is where sometimes providers are challenged, right? Because we are pushed to see more and more and more patients, and with the costs of healthcare as high as they are. But we know we need to almost see less patients and spend more time with the patients we have. And it's a challenge. And just so everybody knows, it is a challenge, but it's something that we have to continue to work at.
Right. Great. Thank you. And I think we have one more question that came in the chat here. This is a broad question, but I know you can handle it. This is very helpful, and I hope that other providers are aware of the importance of health literacy to patients and their families. Besides the patients and families asking for more clear and better information, what else can individuals and patients do to help raise health literacy in the U.S.? Are there any advocacy opportunities to increase health literacy through schools or other channels? It seems like there is a need for systemic change.
Wow, I'll be back tomorrow for another hour presentation on health literacy. No, it's a talk in and of itself. And maybe next year we can, dedicate a whole half hour to health literacy. One of the things that I think is essential to health literacy is a practice called teach back. And what teach back is, where the providers, they've discussed issues with the child and with the parents, and then at the end of the session, end of the clinic visit, they will say to the parents or to the child themselves, tell me what I just instructed you about this or that. And then the parent or the child has to repeat back what they were just taught. So oftentimes a provider will say to a child, a teenager, or a parent, did you understand what I said? And they'll shake their heads yes. But in fact, they didn't understand. And it's only when you say, can you please explain back to me what I said, that they said, well, I really can't explain back. That's not on the child or the parent, that's on the provider. Because then my response has to be, okay, I didn't make it clear. Let me make it clear again. And so if there's one element or one approach to enhancing health literacy, that's what I would recommend, is using teachback. And that's something I think we have to continue to teach providers to use. Providers often say, well, it takes too much time. It doesn't take that much time. I can tell you, I do it. It doesn't take a lot of time. And in the end, it really facilitates better care. So that's a sort of short answer, sort of a moderately short answer about how to begin to address the issue of health literacy.
That's so true. I mean, that's absolutely true. And I try that all the time with both of my children.
Yes.
It's a great strategy and a great suggestion. We really, really thank you for you being here today, Dr. Warady. Really, it was an interesting presentation, and we really appreciate you. Thank you so much for being here. And thank you for everyone who tuned in. We are going to go into a break now, and then please come back at the top of the hour for our next session, which is about vaping, smoking, and marijuana use, and talking about it before that starts.
No, that's a whole another shared decision-making issue.
Exactly. Thank you so much, Dr.
Okay.
Warady.
All right. Bye-bye. Thanks, everybody. All right. Bye-bye.
Bye.